So we are back. It really looks like a marathon, but okay, we still have some nice presentations. So now we have a series of three presentations. So the first one, it's coming from Romania. So Romania was very active today. It's about the Somnology Development in Romania. So he's the Professor Dr. Florin Mihaltan. He's the head of Pneumology Department, Davila University in Bucharest, and is the president of Somnology Section, Romanian Pneumology Society, a member of Romanian Medical Academy. So as we see, sleep was not much present today, even if we had a sleep specialist. And now we saw that it's very interesting to see some updates about what's going on in Romania, how this was founded. So this is why we are sure that Professor Mihaltan will have a lot to say to us. So thank you, Professor Mihaltan, being present here with us.
Good evening. Thank you for your invitation. I made a little registration, 12 minutes, with my colleague, Dr. Anca Hâncu, and I try to share this. And after we have enough time for discussion, I hope.
Yes,
now
perfect.
I'm trying to share my
if I may say, just to not forget the sound when you share, so to be able.
Okay, but I try to find the. Just a minute.
Yes, no problem. So meanwhile, I think if not, I will look myself, because I think I have your
Am făcut share de pe calculatorul meu. Adică al tău. Da, uite asta.
It is an honor to introduce you, Professor Florin Mihaltan, pneumologist, professor.
I don't know if it works.
Let's try if it's shared. Normally, if the sound was
I cannot see my registration on my screen. That's why I have this problem.
Okay, so Dr. Anca Hâncu, she will do the share. So normally, okay, perfect. So just the sounds to be sure it's working. I think the sound was not chosen for the sharing, so this is why we don't hear the sound. So when you do the share, there is a little on the left, square to be checked, sharing sound. Or if you, Anca, if you are there to do it.
It's okay now? You can hear the movie?
Yes, but it's very, very low. Now it's better. It's increasing. You can.
Yes, I have. Now it's
He is
okay.
the president of Romanian Somnology section of the Romanian.
Can even made a bit higher because I see it's 85% there on the right bottom.
Very long history, because if I'm thinking again the first moment before
It's okay.
1889, nobody knows anything about somnology. After 2000, I had the opportunity to work into big and well-known services, one in France, Professor Mieghem, and the other one in Germany, Professor Teschler. Here I made the first steps. I started as technician, and after I learned many things how to organize a sleep lab and what I have to do when I'm will come back to Romania. This means that in 1995 I started to organize the first lab. 1996 the lab was working. It was established in Romanian Institute of Pneumology, and it was the first active lab for Romania. But it was not enough because nobody knows anything about what means sleep disorders, and I had no patients. That's why the second step made very quickly was to launch the first book on sleep disorders.
So, Professor, which is a challenge to build somnology competence? Because practically you build specialty competence in Romania.
Yeah, there are many things I made before, and there are other things to imagine in the future. What I organized after it was the training for trainers, and this was very important because in all the big university towns we need to have a lab. And this lab was of course organized by some of my colleagues. And here I have to mention some big towns like Cluj, Iași, Craiova, and Timișoara. And to have also patients, we made many symposium, webinar, and other official meetings, not only with one physician, but also with nose air specialists and with GPs. This was very important because they brought after some patients in our services. We had also another type of actions to train our specialists in therapeutical area. And here, what was very important, was really a challenging subject, was to learn how to deal with CPAP therapy, and of course, what is the moment when we can intervene with CPAP, and what type of syndromes we need to send to other specialists from other area of specialties.
Practically, you have to increase awareness about sleep disorders, also inside medical community and also for the general population.
Yes, it was very important with awareness and awareness actions. And what was very challenging at the same time was to have the approval from our authorities to use and to introduce in the curricula of our students, of our young residents, this training on a total new area like somnology. And what was also important was to be compensated as actions and as investigation this type of assistance in our hospital. We succeeded finally to obtain a covering from the insurance system for polysomnography and polygraphy, but it remains still the problem of compensating and covering CPAP therapy. And here, what I have to add, this is the problem of all the sleep labs, and generally for all the people who are assisting patients with non-invasive ventilation, as that there are missing specialists, and that's why we continue even in this heavy pandemic times our competency. We have a new generation every year of specialists in somnology, but we create, and we have just an examination this month, the first generation of specialists in non-invasive ventilation. It's very actual because in many units of intensive care, we need this type of assistance, and not all the specialists are familiar with non-invasive ventilation.
How many somnology labs are now in Romania?
There are almost 70 labs, and we created and we trained more than 170 specialists. All greatest part of them are lung physicians, but in the last 2 years we trained also other specialists coming from other specialties, like the nurse specialist, the cardiologist, intensive care specialist, GPs.
Thank you very much, Professor. Congratulations for your work in Romania. Now, questions.
Thank you also for the invitation. I know we have still many things to do, but lifestyle is very, very important to be assimilated with somnology, and a good sleep in lifestyle, healthy lifestyle is very important.
Thank you for the presentation, and I would actually like to I have a question until we are getting other questions or comments. So if I understood well, SLAP laboratory is linked with pneumology.
Yeah, it depends. Somnology, sometimes it depends from one country to other. In Romania, the biggest interest for somnology is coming from lung physician. But in the same time, we have, of course, labs with activists coming from neurologists. Few are internal medicine and nose and air specialists. But in this big number of labs existing in my country now, lung physicians are on the first line.
Okay, I understand. And so the people can, I mean, if someone who would like to diagnose for the sleep apnea, I mean, one of the most, I mean, also lifestyle related sleep disorder, it's the person has to go in the laboratory, or can have also the little machine which can take home and then just bringing back to be interpreted, or is just in the laboratory going on?
In our labs, it's of course a big pressure coming from outside. There are many people with different sleep disorders. And we have in the same time in my lab also polygraphy and polysomnography we are doing outside in ambulatory. It means that they are coming, they are taking the engine and they are doing their own registration at home. In this COVID period, what I have to emphasize, because this is probably a big issue for all the labs in all the countries, the activity is diminished. It was 40% diminishing of activities in all the labs in most part of the continents. And the priority is to make the registration at home, not in the hospital, because also our hospitals and my department is allocated for COVID treatment. It means that we have to prioritize some other diseases, and not to neglect in the same time all that means activities of the sleep lab. And what I have also to add is that the condition and the modality to realize now the activities in the lab are a little under other rules. They are not the same because we have to protect our personnel and also protect the patients. And this is important because all the epidemiological evidence demonstrates that we are raising our contacts, and it's possible to have in between our patients also patients COVID positive.
Okay, I understand. And last question, if it's not popping up. So the diagnose, what can be done in the laboratory, like routine, it's something, it's just the sleep apnea, or you have also the restless leg syndrome or something else? And then what is coming afterwards? So the person can have a CPAP or something, which are those what are reimbursed eventually by the state? Or
80% of diagnoses are, of course, OSA, I mean, obstructive sleep apnea syndrome. But we are also trying to diagnose narcolepsy and catalepsy, and also restless leg syndrome. It's one of the options. In this, when we are detecting such diseases, we are collaborating with neurologists because we need this multidisciplinary team. Concerning CPAP therapy, I think lung physician has the biggest experience here. And a difference concerning CPAP coverage from the insurance system between our countries and other countries in East Europe is that it is not until now compensated but state. And this means if we are speaking about lifestyle, that patients are accepting only when CPAP is intervening spectacular. If not, they are not. They have not the capacity, financial capacity to do it. And in many cases, they are trying 2 or 3 months with therapy, and after they are renouncing. And this effect, and it is as an echo in their lifestyle, very evident, not only individual lifestyle, but family lifestyle.
Thank you. And we have a last question. What recommendation do you prioritize for patients with OSA and obesity with BMI higher than 35? Bariatric surgery or comprehensive lifestyle intervention?
Of course, we are combining in these patients, first of all, CPAP therapy with comprehensive lifestyle intervention. Bariatric surgery for our patient, we are recommending only after, with BMI over 40. And the second thing, very important in Romania, and I have also to underline this, before having all these labs and all these specialists, the only current option for treatment was to be to indicate surgery in a nose air specialist or bariatric surgery. But bariatric surgery without polygraphy or polysomnography was a real danger. And now all the anesthesists learned, it was a very important lesson, to make before this intervention a test, a polygraphy or a polysomnography, to treat with CPAP therapy 2 or 3 months, and after to try to do the real surgery, bariatric surgery. And what is also as a conclusion for this type of patients important is not to lose a patient from the eyes of lung physician, because after bariatric surgery, they are diminishing 30-35 kilo, but it means not in every case that they are losing their OSA. And we have again to make another polygraphy and polysomnography and probably to adjust the levels of pressure for CPAP therapy or BPAP therapy. But coming back to lifestyle, after my opinion, COVID was a unique opportunity. This is one of the benefits of COVID, to bring again in all the authorities' eyes this very important sleep aspect. Because in COVID period, if you are not sleeping 7 hours, you have many risks. It's not only for the medical personnel, but it's also for population. You can have this post-traumatic syndrome or burnout syndrome. Even it's valuable also for COVID patients or non-COVID patients. And also for medical person who is working in COVID sections or COVID department, and person who are not working. And that's why one of the advantages is it was integrated as recommendation, not only by WHO, but by all the guidelines of the sleep societies with correct treatment with sleep of all these patients, even if they are healthy or they had already this COVID disease.
Okay. Thank you very much for this very useful information, and
Thank you
congratulations
also
for the